Dr. Giyaur, and I would like to talk to you today about threads. It's a very common question that comes up. A lot of people come in, they're asking about threads. They're very popular in Europe, they're very popular in Korea, and have been popular for many, many years. They're a little bit slow to come to US, but they're becoming more and more popular in the recent years. So I wanted to just address some of the more common questions that come up with my patients. So threads are made of mostly BDO filament, and PDO thread is actually a surgical thread that we've been using commonly for years and years and years, very successfully in the actual surgery. Now, what Koreans did years ago, they turned the surgical thread into a little bit of a different technology. And what they invented is a thread that we can now use in a non-surgical way, so in a non-invasive way. So threads come in two main different varieties. There's something called mono thread, and there's something called lifting thread. So I'll first talk about mono thread and what the point behind them is. Mono threads are little tiny pieces of threads that go under your skin in a very minimally invasive fashion and fairly painlessly. And the point of them is that they stimulate collagen and elastin. So they'll stay under the skin for a period of 2 to 4 months. And while they're in the skin, each thread stimulates some molecules and molecules of collagen and elastin. So obviously we all know that collagen and elastin mean youth, and our appearance really changes. So usually the procedure of mono threads is good for anybody. Anybody who feels they're aging and feels that they're not looking as fresh as before anymore, this procedure is good for, because it will stimulate collagen. So anybody from after the age 25 is no longer making collagen. So at about age 30, we start to recommend these mono threads to our patients, mainly to stimulate collagen in, let's say, problem areas, usually around the eyes. And then as the person gets older, every year, every few years, we like to do kind of a full face mono thread procedure to just continue and keep them look younger as they age. So the next type of thread I want to talk to you about is barbed thread. So that's a completely different animal. Barbed thread is a longer thread, and it has little tiny barbs or hooks on it. And the point of that type of thread is, yes, to also stimulate collagen and elastin, but the main idea behind it is to provide a lift. So again, this is not a surgical lift. This is a minimally invasive procedure that's done under local anesthesia right in our office. But what these threads are able to do is they're actually able to lift tissue. They again stay in the body for about 2 to 4 months. They're also made of BDO. As they're staying in the body, they're stimulating collagen and stimulating elastin. That's why even though the thread is gone after 2 to 4 months, the actual effect from the thread lasts much longer. It could last up to a year. So it could be done for different areas. Some people like to lift their eyebrows. There's a procedure that's been popularized by celebrities on the internet, and that's a cat eye procedure. Another popular area for thread lifting is to lessen the nasolabial folds and to lift up the cheek a little bit, improve the jowl area, and tighten the neck. So all of these areas can be done with threads, and sometimes it could be done just in a particular area that's of a problem, or it could be done to the entire face and neck area. For this procedure to be effective, certain criteria have to be met. So the number one criteria, obviously, you have to go to a provider, you have to go to a doctor or whoever that knows what they're doing, that has experience with lifting threads. That's a number one, and that's a no-brainer. Very important issue is that a lot of these threads are not made well, are not made by proper companies, by well-established companies. So you have to make sure when you go to your doctor that the thread that they're using are high quality. High quality threads will last longer, they will do what they need to do. And the third thing that I wanted to tell you about is that there has to be a right candidate for these threads to work properly. And you know, if your face is very thin and there's not a lot of tissue, not a lot of fat and on the face, you might not be the best candidate for the lifting thread procedure, because in sometimes you could actually visualize the thread through the skin. And then on the other hand, if your face is too heavy, that may not be also the right procedure for you, just because there's only so much lifting that can be done that's non-surgical. So the ideal patient for this type of lift is from the age of 30 up until 55 or 60, depending on the face, really. And so a person who fits into that criteria is an excellent candidate for thread, most patients. Now, some of our older people are also getting this procedure done, but these are usually people that have had other stuff done and are actually looking younger than their age. Obviously, what you have to know is that the procedure is not a replacement for surgery. A facelift or a neck lift will obviously achieve a lot more and will last longer than the thread lift, but there are certain advantages to a thread lift. It's way less invasive, it's less expensive, and the downtime is a lot less as well. So we do recommend thread lifting very highly to a lot of our patients, and it's becoming more and more popular.